extreme pain, dizziness, and shortness of breath. Environmental illness specialist Dr. Ritchie Shoemaker suspects that Lyme disease might be the cause of Timmy's agonizing symptoms. Until the results of his blood test come back.
And he sat me down and he said, "You definitely don't have Lyme disease, 100%.
His tests were negative. Lyme was not his problem.
But the blood work does confirm that Dr. Shoemaker is on the right track.
The evidence of inflammation that we saw in Timmy's blood was widespread. There's no question that Timmy had a biotoxin-associated illness.
A biotoxin is a poisonous substance produced by plants or animals that can be harmful if ingested or absorbed into the human body. Dr. Shoemaker now needs to identify the biotoxin that's causing Timmy's excruciating illness. He turns his attention back to the environment.
How about mold? Could Timmy be exposed to mold from his home?
It's possible that poisonous biotoxins are being released into the air by a colony of mold growing somewhere in Timmy's house.
He asked a lot of questions about mold, whether or not it was wet in the house and different things.
But the home doesn't fit the profile of a mold-producing environment.
Well, his home is new, it's dry, there's no evidence of water damage.
He excluded mold right off the bat.
Next, Dr. Shoemaker turns his attention to the water.
All I do, as I fish, I fish 5-6 days a week. All over the bay, a lot of places in the bay and river.
Dr. Shoemaker now wonders if the biotoxin poisoning is coming from the Delaware Bay. And he considers an unusual suspect, a bizarre natural phenomenon known as a red tide. Red tides, or harmful algal blooms, refer to a rapid overgrowth of algae in large bodies of water. This algae sometimes contains biotoxins.
These biotoxins are simply made as the microalgae grow. They have a certain level per cell, and they're always there within the cells, but they can be released as the cells grow or as they die. With a heavy wind blowing in one particular direction over a sustained period of time, that can concentrate the microalgae in one particular area, giving a very high density.
It is this high density that makes the algae harmful and causes a red tide. Dr. Shoemaker suspects that while out fishing, Timmy was exposed to a red tide involving a harmful species of algae known as Karenia brevis. But there's one problem. Harmful red tides rarely occur as far north as Delaware.
Blooms typically occur in the Gulf of Mexico, where the water obviously is very warm, so it's adapted to those warm temperatures.
Dr. Shoemaker's theory would have seemed all but impossible until the summer of 2007. In a warm patch of ocean in the Gulf of Mexico, a colony of Karenia brevis algae begins to reproduce, multiplying exponentially. Then, the colony makes its way into the Gulf Stream.
It probably entered the Gulf Stream on the western side of Florida, and then would be swept into the Gulf Stream, making its way around the tip of Florida and then up the east coast.
Normally, colonies of algae are swept out into the middle of the Atlantic Ocean, where they die. But in the summer of 2007, the ocean currents take an unusual turn.
The Gulf Stream waters then migrated north and then probably broke off from the Gulf Stream and then migrated inland.
From there, the rogue colony of Karenia brevis seeps into Delaware's waters, causing a red tide.
This event in 2007 in Delaware was really a once-in-a-lifetime event. As far as we know, the bloom has never occurred there before.
Some believe this unprecedented event is due to global warming.
Red tide is probably best thought of as an illness that is a canary in the coal mine for climate change globally.
This tropical species is going to be able to move further north, potentially due to climate change.
For Dr. Shoemaker, all of the pieces in this toxic puzzle finally fit together.
There was red tide in exactly the areas where Timmy was at the time Timmy got sick. In the final analysis, Timmy's illness begins explosively, and it begins when he's exposed to red tide.
But how did a red tide set off an illness with such wide-ranging symptoms?
In a red tide, there will be a mist of very small particles that people can breathe.
According to Dr. Shoemaker, his immune system then mounted an attack on the foreign invader, causing inflammation throughout his body.
The symptoms Timmy had are directly attributable to the inflammatory responses. It is a progression to worsening cognitive function, worsening joint function, worsening respiratory function, and worsening fatigue.
Yet very few people actually get sick from red tide exposure. So why this time?
Timmy is an outlier with genetic susceptibility. If we look at 1,000 people exposed to red tide, 995 plus of them are going to be fine. 5 of them will be Timmy's.
Dr. Shoemaker shares his diagnosis with Timmy and Morgan.
When he finally come to the conclusion that it was red tide, I mean, I knew that that's where I got it from, definitely.
It made a lot of sense. Everything that had been going on from the first day, everything.
Dr. Shoemaker immediately starts Timmy on medication called cholestyramine, usually used to treat high cholesterol.
We found cholestyramine helped a very large percentage of patients.
Dr. Shoemaker believes cholestyramine rids the body of biotoxins the same way it works with cholesterol, by binding to it and eliminating it through the urine. 3 months later, Timmy is almost fully recovered.
He's back to normal. He's not exhausted 24 hours a day.
Every day is normal. I mean, I'm back to being old me again.
There was just a new spark in him that I hadn't seen in a while.
And Timmy's back on the water doing what he loves. But Dr. Shoemaker warns him to stay off the bay during the summer months, when conditions are ripe for a red tide bloom.
I've got 8 months a year that I can fish. I still got my boat, and I'm still fishing, and I'm still going to continue to do so.